Are we
Okay, we are ready now.
Well, thank you, Blanca. Good morning, everyone. This is Dennis George, CEO of APS, and I really appreciate the time of all of you joining us. Deterra is our new product in which helps with patient safety and disposal of appropriate ways of your narcotics and unused drugs at home to take them out of the illegal drug system and also protect our environment by disposing them correctly and in a way that's not hurting our communities and our water uses down the stream in our cycle of life. So it's been a nice journey that we've been on to bring Deterra into the program. I know from the KHA we have a drug initiative toolkit that we'll be sharing out with all the members, and this will be brought available. And on Missouri side, we will be doing the same program, but with the Missouri toolkit. The nice thing about Deterra is this is a very proactive to where in your community, if you're looking at funding, if you're a 340B hospital, this is one way to really support your community with 340B financial benefits in your use of the 340B dollars. Also, this is one way to bring in consensus in your community through your auxiliary or well with your community activist groups into which they're looking at helping out with our opioid crisis. Again, I am very proud that we were approached by Deterra to see if we could bring a program to our Missouri and Kansas organizations to look at deleting the necessary drugs out of the illegal supply as they get misdirected, not necessarily on purpose, but sometimes by chance, and then also help with the green world. So I'd like to turn it over to the team. And again, it's exciting that we get to kick this off today. So Megan, I'm going to turn it over to you to introduce yourself and Nancy, and then share with us the Deterra opportunity for prevention of narcotic issues in the future, as well as prevention of illegal use of drugs as well as in the community and our water resources and the environment. So welcome and thank you very much.
Great. Thank you, Dennis, for the introduction. We also have Nancy Devine on the call. She's our Chief Operating Officer of Deterra Drug Deactivation and Disposal System, or I should say Verde Environmental Technologies, the maker of Deterra Drug Deactivation and Disposal System. I am Megan Schiavone. I am the Strategic Account Executive. I help support Kansas and Missouri implement Deterra and educational primary prevention programs. So I work a lot with hospital systems, government, public health, behavioral health, coalitions, drug task forces, etc. And if you have any questions after this presentation, please feel free to reach out to me. I'll include my contact information at the very end. But I'm excited to share more about Deterra with you today on this call. Nancy, do you have anything you would like to add?
No, I'm just looking forward to the presentation, and Megan's been with Verde for about 2.5 years now, so she has a wide variety of knowledge and is here to give you some ideas based on what her other customers in your space are doing, and hopefully that'll bring some discussion and questions and lead to a successful program. We're really happy to be working with all of you through APS.
Thank you, Nancy. So today we want to talk about what is Deterra, why Deterra, some of the community impact that we've had across the country and in your states, distribution ideas, collateral, and news. But first, just kind of at a high level, Deterra was developed under a small business innovative research contract with the National Institute on Drug Abuse, which is a division of the National Institute on Health. And we were developed to help solve two societal challenges: the opioid epidemic and reduce environmental impact of pharmaceuticals and other drugs entering our waterways and ground systems. Our mission is to save lives and protect the environment through evidence-based universal drug deactivation and disposal systems, permanently rendering drugs inert and irretrievable for all practical purposes. So why Deterra? We really see Deterra as the critical part of the prevention solution, disposing of drugs properly, removing them from circulation in our communities. We have a wide variety of products and different sizes of pouches for individual use, and then our containers for bulk disposal. There's a lot of different settings that all of these can be used in, and I'll get into that in a little bit more detail moving forward. But we want to be the solution backed by science, and we have very specific carbon to drug ratios to make sure that all the drugs that are put into our products are rendered completely inert and deactivated. So the problem at hand, the epidemic that we are facing, nationally, we know more than 60% of people hold on to opioids indefinitely, greatly increasing the risk that a child, friend, or relative could misuse them. And there's just a lot of years of overprescribing and availability, or room for diversion, essentially. So we are trying to mitigate that risk in teaching and educating our communities, employees, on how to properly dispose of these drugs. We know that every day 1,000 American kids abuse prescription drugs, and they start experimenting as early as 12 years old. So really the solution to stop a problem before it starts. A little bit more about our, science behind our product. We are the only drug deactivation system that is scientifically proven and third-party tested to render drugs inert, meeting the DEA standards for deactivation. We have 11 patents in the US and 33 patents internationally. And we take a lot of pride, and we've made a lot of wonderful decisions on creating a more sustainable product and in our manufacturing processes. So I'll get into that a little bit more in detail. But we use a proprietary activated carbon and a method of adsorption that renders those drugs inert. So this is just a little bit more about some of the details in our creation, as well as our partnerships. We are the only drug deactivation and disposal system that is endorsed by the DEA Educational Foundation and Community Anti-Drug Coalitions of America. We also have partnerships with Mothers Against Prescription Drug Abuse, the National Consumer League, NACO, which is National Association of Counties, and really the list goes on. So we're happy to provide that comprehensive list if needed, but you can also find that too on our website as well. So I want to do a demonstration and talk a little bit more about the science behind our product. Inside every pouch is a water-soluble pod that's filled with that proprietary activated carbon. So once you open the pouch, you'll see this pod. You'll put in the medications, whether it's a liquid, cream, balm, patch, or just pills. So for example, this is our small pouch. It deactivates 15 pills, 2 ounces of liquid, or 2 patches. So you put that inside, you fill halfway with tap water, and that water is going to go to work to dissolve that pod. So similar, think of like a Tide pod. It's going to release the carbon, and the carbon is going to go to work immediately to adsorb the medications at the molecular level. And I say adsorb with a D. That's a very important distinction because that's the component that renders the drugs completely inert. I'm not a scientist. I don't have a science background. So what really helped me to understand the process of this activated carbon is relating it to tie-dyeing a t-shirt. So once the dye adheres to the cotton fibers, you can't extract it. It's in the t-shirt forever. You may get some dye bleeding from the t-shirt because that's because the cotton can only hold so much dye. So that's the same with the carbon. Every little pocket gets filled up. Once those are filled up, there's no more carbon to adsorb the drugs. So that's why it's very important to follow the instructions, which are on the back of the pouch. Or use a pouch that will meet your needs as an organization and as a community. So I would say our most popular pouches are medium pouch. This deactivates 45 pills, 6 ounces of liquid, or 6 patches. This is great for cleaning out a medicine cabinet. It's used a lot for community distribution efforts, often coupled with some education, and we'll get into examples of those in a little bit. But this is a really great tool to just encourage residents to take that action and clean out their medicine cabinet. Now, our large pouch, which deactivates 90 pills, 12 ounces of liquid, or 12 patches, this is perfect for the aging population. Hospice nurses find this extremely helpful. Senior living facilities, partnering with Meals on Wheels. Those are some examples of how this large pouch is used, but also say good for community distribution too, because we have many, many years of overprescribing and we know people hang on to those meds. So providing this, I think, is also very smart. And then we have our XL pouch, which deactivates 450 pills, 60 ounces of liquid, or 60 patches, and then our containers for bulk disposal. So if you would like more information on those, I'm happy to provide that after the call. But it's permanent, it's fast and easy to use. It's safe because it's non-toxic, and it's very convenient. We know that consumers use the product within 4 weeks of receiving it, with nearly half reporting use within the first 24 hours. And that 95% had no trouble using the product whatsoever. In addition to just the product and how it works and the science, we also are focused on the environment. We know 1 in 2 Americans admit to improperly disposing of leftover unused medications. This means that they're still being flushed down the toilet or put down the drain. And we know that our water treatment facilities can only remove 50% of pharmaceuticals from drinking water. So we want to be a solution to mitigate that. But we're also very cognizant, again, that our pouches do end up in a landfill. We're generating waste, and that's why we've taken several steps to reduce our burden on the environment. So if you see here on the pouch, it says, "I'm green, USDA bio-based product." And this just means that it's 50%. It's made from sugarcane, which is a renewable resource. And our plant that manufactures this pouch in Houston, Texas, runs 100% on wind-generated electrical energy. It's LEED Silver certified. And we even take the steps to reduce our ink consumption. We use a process of ink printing that cuts down our ink waste up to 95%. So reducing and committing to reducing our CO2 emissions by implementing these sustainable manufacturing processes, and then also being assured that there's no way, if by using the instructions on the back of the pouch, that those drugs are unavailable to penetrate our waterways and our ground systems. So this is a study that was done by NIDA on our product. We didn't pay for this study. The next few that I'm going to share with you were all third-party studies, clinical trials that were done on Deterra. And then we were provided the results. I have full reports on these as well as case studies. So if you're interested in reading more in detail about this, please reach out to me after the presentation and I will provide those to you. But from that study, we know, and this was interesting to me, but we found that 91% of consumers used the pouch because they were concerned about preventing damage or harm to the environment. We know that it's not difficult to use, and we know that 96% used the pouch 4 weeks or sooner after receiving it. So that's all very positive. The next study, this was done by JAMA Surgery. This was a randomized clinical trial. And I'll just briefly kind of go over some of the highlights of this. But again, it shows us we know 7 out of 10 post-surgical patients had leftover opioids. And we know that 18% of post-surgical patients with leftover opioids disposed of them properly. And when given the pouch, that increased by 8 times. They were 8 times more likely to dispose of the opioids outside of other more traditional methods, which are our drug take-back days, which happen twice a year, or are some communities, and not every community has these, but drop-off locations for pharmaceuticals. When given an easy and convenient way to do it, and to clean out the medicine cabinet, they were more likely to do it quicker. Also, JAMA Pediatrics did a study, and the results are even higher as far as the usage. We know that the parents were 43 times more likely to properly dispose of opioids when given the Deterra pouch. And as a parent myself of 2 young boys, I completely resonate with this. If I was given a pouch, I know for a fact that I would use it. Even if I have leftover amoxicillin, if they don't use the full dose, which they should, but if they don't, you can use the pouch to properly dispose of it. And so, yeah, this study definitely resonates with me. Another great case study that was done on our product is through Summit County. This one gets me really excited because they're really early adapters of Deterra. They've been implementing it community-wide since 2016. These results took a lot of work. They took partnerships with over 160 community partners, from barbershops to police to law, to fire to public libraries. You name it, they were partnering with everybody: pharmacies, senior living, hospice. And their whole goal was to change the behavior of how medications are treated, stored, and disposed of. And it's been really successful. They really realized a 17% reduction in opioid overdose deaths in 2019 versus a 6.6% increase in the rest of the state. We have, they did a case study on this. We have a case study on it as well. But over the 3 years of the project, overdose deaths decreased by 56% in Summit County. And that's really tremendous work that they have done, and are huge champions, and we applaud them, and it's really exciting to see, and that's been just snowballing and replicating throughout the country as well. So how do we get to some of these numbers to realize the benefits of community distribution or providing them to your employees? And really, what is the cost benefit? And we developed a health economics outcomes calculator that helps to calculate the cost savings a community will realize by helping members properly dispose of leftover medications. So with that being said, it was developed using data from 12 published studies to model scenarios based on the number of households with unused opioids, the likely of proper disposal behavior, the prevalence of opioid use disorder stemming from misuse of opioids in the home, and the costs associated with opioid use disorder. So if you look at this little chart, this is if you were to distribute, this is just an example, 200,000 medium pouches, you can have a cumulative reduction in costs in healthcare claims, productivity, and criminal justice costs of $3,862,511. So we can tailor this to your community, to your organization, if I know how many employees there are, if I know how many residents, and if every household was to receive a pouch, what that would look like as far as cost savings. I'm happy to assist with this. I do it all the time. So please reach out to me if you'd like me to pull a health economics report on your community or organization. So we want to improve patient outcomes and mitigate risk. And I'd say not just patient, but also community. And this is really a 24/7 safety initiative. This is safety in the workplace. This is safety at home. We know that when you make Deterra pouches available to your employees, you can reduce several significant safety risks that come with on-the-job medication use, misuse, and overdose, and an increase overall workplace safety. Same for just at home and in the community. We want to improve health and wellness overall, and we want to raise that environmental awareness. So there are several ways that this can be implemented in hospital systems, also in the community. This is just a list of current, hospital systems and organizations that are currently implementing Deterra. The picture to the right, and I'll get into a little bit more detail on this in a couple of slides, but it just shows Mayo Clinic wrote an article. They are still implementing this to this day, but this is a small pouch sitting inside a container with a bottle opener that they created to mitigate the diversion of propofol in the operating room, as well as environmental contamination. Best practice prior to this was just dumping it down the drain or throwing it in the trash. And so they wanted to reduce that impact, but also noticed a higher diversion amongst their nurses with this particular drug. So the results on this article are amazing, and I'm happy to share it again with anybody who's interested in reading more. Also, healthcare providers use Deterra to, relinquish drugs and medications, expired medications, changes in medication, incomplete deliveries, abandoned medications. This can be at the pharmacy level, providing this to patients who might be in treatment or recovery, pre-admission, and then also post when they leave and go back home. But providing to families at end of life care. Often they're left with all this medication. They don't know what to do with it. The nurses don't want to be responsible, so we want to reduce the liability on them. And we also want to use it as a way to say, hey, we care about you. We care about your family. We don't want any accidents here. Use this in your home and throw it away in your household trash. These are just more examples too of treatment providers and how they are using Deterra. And then also ways to implement Deterra. If you're an employer, there's a lot of initiatives here for safety, national drug take back, community service, health and wellness, also Earth Day, an environmental initiative. We're breaking down the stigma of what medications we have in the home, but we're also considering the environment at the same time. So back to referencing the propofol study done by Mayo Clinic. This was a great study, and they found that implementing Deterra decreased the percentage of unemptied propofol vials remaining in unsecured bins from 44.1% before intervention to 0% post-intervention. Inspira Health just did a wonderful study over 3 years that they just recently published not too long ago on C-section patients and postpartum patients, and the likelihood of them disposing of their medications was 3 times higher than before intervention. So they will continue with that program. Also, Optima Health and Verde teamed up to deliver Deterra to patients at over 60 Centara medical groups offices in Virginia and North Carolina. So that was a big push and a very exciting partnership. And I want to talk a little bit more too about the ideas for distribution within the communities that you serve. Those were all organizations that did their own thing. This is all, very tangible things that we can do on a daily basis, or even, partnering with other organizations, bringing community together. The biggest one and the most impactful that's been really popular lately is a mailing initiative to every household. This is typically coupled with a piece of education, a postcard that can be customized with different messaging, even if we're including like suicide prevention hotlines, hotlines to treatment and recovery resources. Maybe it's more of the environmental messaging. You know your communities better than we do, and that's why we want to work with you to help develop the best messaging and that education piece, coupled with that tangible item, the pouch, to turn that education into action. So there's a long list of community partnerships. When we reference back to Summit County, I think what they did takes a lot of time. It takes staff, and sometimes we're short on time and staff, or one or the other, or both. And that's why the mailing initiative has been extremely popular. It's just, you hit 100% of the population, or you can hit a specific demographic targeting households with children, or maybe you want to target aging population. It just all depends, but that's what we help you accomplish. Here's just another long list of organizations we've worked with and the various ways that it's been implemented, even with hospice, and like I said, partnering with Meals on Wheels, or doing education at schools, and turning it kind of into a science project as well, talking about the science behind the carbon. It's very fascinating to think that, yeah, it's meant for this purpose, but there's a lot of different ways we can incorporate it in that education aspect. Here's just some news from across the country regarding more community-based initiatives. So Milwaukee County is in the process of implementing harm reduction vending machines throughout the county. Deterra will be included, also some fentanyl test strips, Narcan, even, socks. There's so many things you can put in the vending machines. It's really interesting and rather a new development in that kind of harm reduction space. And then we had New York Oasis do a big push to deliver 100,000 pouches to the aging population in New York. And then San Diego County is working on a mailing campaign to get 1.3 million pouches to every household in San Diego County. So when I talk about labeling and that education piece and the postcard, this is really just to amplify your impact, make your organization known. The benefit of, also can be used as a marketing tool for your organization, but also that push to help everybody in the community get involved in helping to solve the opioid crisis that we are facing as a nation. And that's only been amplified by COVID and the pandemic that, we're coming out of. So These are just a couple ideas I'm going to run through in the next couple of slides of labels that organizations have put directly on the pouch with a QR code. Maybe you are working with a grant and you need data and you want to link the QR code to a quick survey that's anonymous. That's a possibility. Milwaukee County on their label wanted to put videos of how to use Deterra in English and in Spanish, understanding that there might be some folks that are unable to read. And so the videos are very helpful in helping to reach everybody. Also, you can link that survey just to a page on your website with more information and resources. The options are endless, and that's what we work with you on to help customize. Here are just some examples of postcards that we've done in the past. This is one that Douglas County in Wisconsin used, Stop the Opioid Crisis in Our Community. And then we have one of these where it talks about medication safety. Also, you know, if those medications are still serving you, to please store them properly. And if they aren't, use this pouch with larger directions. And then these are just some more examples. The bulk mailing, the online survey, and the custom pouch. Those are all options that we can do. In addition to kind of that custom pouch or postcard or label, we provide a lot of free resources and tools to help make your program more successful and to kind of reduce the amount of work that goes into creating the awareness or educating the community maybe before something like this is sent out. So our marketing team is fantastic. They developed this social media kit. So you don't have to reinvent the wheel. You don't have to think too hard about it. You can tweak it or adjust it accordingly. But there's also a media pitch template. So if you're looking to get some PR for this project, or if you're you have a lot of great earned media or paid media in your community, what does that pitch look like? So talking points, and then free customizable collateral. So depending on who you're trying to work with or target, let's say it's a pharmacy you want to partner with, we have collateral, and all of these are links, you guys. So when you follow up with the presentation, you'll be able to click these to gain access. But you will have options to co-brand that collateral. For our pharmacies, we have one that says prescribe peace of mind, and it just talks about the importance of proper medication disposal and storage. We also developed a trifold and more pieces in English and in Spanish to reach a larger population. So what you're seeing on this slide is just a small snippet of that trifold. And I can send you more information on that after, but we want to make sure we're being as inclusive as possible, and we want to make sure we provide these resources to make your initiative successful. If you are looking for case studies on any of the information that we talked about, or maybe you want a case study on hospice, I can provide that. Maybe you're applying for a grant and you need more of the evidence-based, the statistics. We have all of those available for you as well. So local and state government distribution to household. This is just a quick list of what we've done and what we're working on. And then our funding resources. I wanted to include this in here because we know that this can be a hurdle. We have developed a Deterra grant guide that provides expert tips on funding, example budgets, and logic models. And again, those case studies, because we are considered evidence-based primary prevention, you can find that all within the grant guide. We also have a funding directory, and these are just some of the ideas I've pulled from the funding directory to share with you. On grant opportunities that are available for primary prevention and in-home drug disposal. So whether you're an indigenous community, you're more rural, or you want to partner with a foundation, there are a list of foundations that have prevention as an initiative. Also, there's law enforcement, state and local government. So all of these are linked here. And we're kind of happy to, we're very happy to walk you through this process, share what others have done that's been successful in applying for these grants and being awarded the funding. So to take advantage of Deterra through your portal, through our portal, to take advantage of that membership discount pricing that's available to APS members, you can click this link to create an online partner account. And this is what, once you set that up, you'll get access to all of our products and that discounted pricing. So it should be super easy to use. We can help facilitate that. Again, if you have any questions or if you need additional information, please reach out to me, Megan Schiavone, and I'm happy to help however I can. And that concludes my presentation. Does anybody have any questions right now?
I think Rodney has a question. He just said, will slides be available to attendees? Yes. Will get us the slides, but also this is being recorded, so it will be able to be available to anyone that can see. And then this is just our initial kickoff. We will be actually working with KHA and MHA and our other associations to look at how can we bring this information to our community hospitals and organizations that are partnered with APS and our two state associations to deliver the highest quality of care to our community. So if any of you that's on the call wants to share this link, and Blanca will be sending that out to all of you, we're willing to have that on our website and also on the grants. I'd like if you could send me those grants. We'd like to have that on our website so people can reference that, because that's a great guide that is exciting to me, that then we can help coach people up to look at a way getting a federal grant to enhance the communication in the relieving the narcotics crisis to a lower level by having this available to our community. So if you can get us those grants too, we'll get that out to people to look at the availability to fund this program.
Yes, of course.
Other
Thank
questions?
you, Dennis.
Rodney's typing.
Okay.
Like he said, love the idea of the grant opportunities. Funding is always an issue. And when you saw the article in Becker's this last week, I believe it said 56 hospitals in Kansas is close to closing, and we're number 2 in the nation. So if we could do this, and again, when I look at Western Kansas and some of our resources out there, this would be very helpful in our smaller communities. But again, I'm just excited by having that grant information that we could use in our collaboration model.
Great.
Other questions from anybody? Nancy and Megan, thank you so much for the opportunity to work collaboratively with you. Like I said, it was a cold call by Rick Belsky on one day traveling through Kansas. Stopped by, we talked for about 2.5 hours. And so that's what's been a great journey to bring this out to our members. And it's going to be nice to share and help be an impact on the opioid crisis and our drug diversion issues in America. So I really appreciate the opportunity partnering with all of you to bring this to our membership.
Thank you, Dennis. We really appreciate the opportunity to partner with APS and all of your members, and look forward to this continued collaboration moving forward. So thank you.
And I think the other thing that I will be sharing this at the KHA board meeting, and if you could give me the grants electronic, I'd like to pass that out to them at that
I
meeting.
will.
Then I'm going to ask our Missouri Hospital Board to do the same thing as part of their education. Bad thing is I can't be in two places at one time. They're both happening at the same time next week. So appreciate all of your efforts, and I love the evidence-based process in this. You can't argue with the science. And again, also with our water issue, that water is important. Having the ability to diverge, just flushing the items down the toilet is not the best solution, and this is. So I greatly thank you for all that you do.
Thank you, Dennis. We really appreciate it.
Well, thank you all, and all of you who attended today. We appreciate the opportunity to serve your communities. And if there's anything that we can do for you, don't hesitate to send us an email, and we'll be back in response within 24 hours. So thank you all, and you have a wonderful day, and have a wonderful Memorial Day weekend. Also thinking about the sacrifice that many of our men and women across the world has protected us and given their lives for our service. So thank you all, and have a wonderful weekend.
Yes, definitely. Thank you.